Hi, my name is Earl Hayden. I'm a physical therapist here at Spine Rehab Specialists, and today we're going to go over a very common exercise that is very helpful for most people, but unfortunately is done incorrectly. It's called a push-up, the basic push-up. And over here we have Chris. He's going to be helping out. We don't have a mask on because we've both been vaccinated. So first, let's go ahead and show how the push-up is done. Normally what we're looking for, as we go down, we see the shoulder blades move, we squeeze, and really push hard through the motion. Okay, good job, Chris. All right, so the push-up is helpful for so many things. If we're just trying to push open a door, if we want to do some overhead activities, whether it's throwing, volleyball, serving, or just any type of things that involve pushing, this is a good foundational movement to do. Talking about the push-up, now we're going to go over different things that we see that are often done wrong with this movement. So common things we see is maybe like the low back kind of sagging through the motion. See how we're just kind of doing that? And for a lot of folks, this puts a lot of pressure through the back, okay? Other things we can see is maybe we don't even move through the shoulder blades. It's all just coming through here. So that could put a lot of extra stress right through the shoulder joints. And these are all things we'll have to look at and assess here in the clinic. Figure out, is it core weakness that we need to address, and we do have to learn do we have to reteach how to move the shoulder blades? And these are all things that good physical therapists can help. Now let's say you have someone who's having difficulty doing the push-up, they're slouching in the back. So you can stop them doing the push-up. Let's see if they can even do a plank. So let's go ahead and get into a plank position. Right, there we go. So what we're looking for is if they can hold this position good, then they could probably do the push-up. If you see them start to sag down here a bit, then you know that's something you're gonna have to work on. Okay, if they can't do this, go ahead and get into a quadruped position. Then we can even work in this position. So there's less pressure on the back. It's a little bit less stress on the abs, but it should be easier to learn that control in this position. Let's say you have someone who is having difficulty controlling the shoulder blades going through that push-up motion. One way to do that is to also work on just the wall. So you have less stress, it's a little bit easier, and you can really focus on working the motion. So go ahead and pull yourself into the wall. So squeeze those shoulder blades back. Good, and then push hard, hard, hard. Really let those shoulder blades move around. And that's what we're looking for with this movement. Those shoulder blades do not stay fixed, they are alive and they move around on the ribs. That reduces stress on the front of the shoulder, and it also allows you to produce a lot more force and makes the movement a little bit easier. So this is a good way to start here. So this is also a good way to start instead of on the floor. Maybe you have some older patients or people who've never really done a push-up before, and just to kind of get them used to the movement. If this is an exercise you're having problems with, or you know someone else who's maybe having some shoulder pains, and maybe this is something that they really need to work on, come see us over here at Spine Rehab Specialists. We can do free consultations, get a good, take a quick look and see if physical therapy is going to be a good fit for you. And a lot of times it is, and we can help you with that, clean up your technique and get you back into fighting condition. All right, thank you.